Hello everybody and welcome to another edition of Eyecare Today. I'm your host Dr. Thomas Kislin and we're coming to you from our Hazleton location. That's Hazleton Eye Specialists, and we're on the airport beltway in Hazleton. Our phone number, if you have any questions, is 453-2020. Again, that's 453-2020. And for our patients watching in the Stroudsburg area, our location in Stroudsburg is Stroudsburg Eye Specialists. That's 852 North 9th Street in Stroudsburg, and our phone number there is 421-3342. Our website is www.drkislin.com. If there's any questions, you can email us on the website also, so please feel free to contact our office with any questions you may have about eye care. What I wanted to do, folks, is go over what's new in the news out there as far as eye care. The great thing about technology and on your little iPhone, I get daily email blasts about new studies that come out, and that's one way that we stay up on what's current. So every day I check and I'll get an email blast about a new study regarding macular degeneration or diabetes. So what I want to do today is just share with you some of these headlines and just go over what some of these studies may mean to your health, your eye care, and what they can do as far as benefiting our health. So the first study that came out was one that actually was from the Journal of Ophthalmology, and this the headline reads, "Study reveals significant drop in vision problems in the elderly." And again, this was from the Journal of Ophthalmology just recently, and what it says is that vision impairment, one of the more common complaints associated with aging eyes, has seen a steep drop in older Americans, according to this new study. And further, what it says, there's been a dramatic drop in vision impairment among older Americans over the last generation. And these eyesight issues that usually limit activity declined by well over 50% in just the last 2.5 decades. And really what this comes from is we do much better nowadays with cataract surgery, so the advances in cataract surgery. We know now that cataract surgery is a 6-7 minute, no needle, no stitch, no pat surgery. So we're more willing to do cataract surgery sooner on patients, which restores vision. Declines in smoking. We know smoking is linked to a higher incidence of macular degeneration. So as we've decreased our rates of smoking in the United States, our incidence of macular degeneration has actually gone down. And better treatments for diabetes also. Diabetic retinopathy, which is bleeding in the eye from diabetes, is one of the leading causes of blindness in the United States. So as we better learn how to manage these conditions systemically, that's actually going to help benefit the eye also. So that study is from the Journal of Ophthalmology. The next study is from the Journal of Investigative Ophthalmology and Vision Science. And this study states that review explains why women may need reading glasses sooner. And basically, this is a pretty simple study, but what it showed is that usually when we get to around the age of 39, 40, 41, 42 years old is when we start to need help up close or reading things. And usually women need reading glasses a little sooner than men, and it's a combination of factors according to this study. One, kind of obviously, is women usually actually have shorter arms. And what happens, because they have shorter arms, reading materials hold closer to the eyes, and that actually stimulates focusing, which puts more strain on the focusing system and causes them to need reading glasses sooner. So that's really the main thing they found with the study. Women tend to hold things closer because they have shorter arms, stimulates the focusing system, causes it to strain a little bit more, so they end up coming into our office complaining of reading issues sooner. So that's when we start talking about needing reading glasses or contact lenses, things like that. This was an interesting study actually out of Egypt. The Journal of Ophthalmic Physiology from Egypt states that passive smoke exposure associated with hyperopia in children. Now, hyperopia is what we call farsightedness. And farsightedness means that children can see pretty good far away, but they need to focus a lot harder when they're reading. And what this study showed is that among children attending the outpatient eye clinic, those with hyperopia had significantly higher levels of what's called urinary cotinine than myopic and those children not wearing glasses. And this is a chemical that's actually found in the urine when there's smoke. Patients are exposed to smoke either by smoking or secondhand smoke. So just an interesting study showing what passive smoke exposure can possibly do. This study, kind of interesting, heat waves during pregnancy may increase the likelihood of congenital cataracts. And so this was published online in the Environmental Health Perspectives journal, and it states that heat waves and other extreme heat exposures during an embryo's critical period were positively associated with congenital cataracts. So I guess if it's really hot out and someone's pregnant, they need to stay in the air conditioning. But I thought that was an interesting study to kind of throw out there. Now, you've heard me talk before, folks, that a lot of things in our body as far as general health can affect the eyes. And this study just kind of proves it. Eye changes may predict later cardiovascular disease in African Americans with type 1 diabetes. And this study was published out of the Archives of Ophthalmology. And what they found was that changes in diameter of the tiny blood vessels in the retina predicted the later development of cardiovascular disease in African Americans with type 1 diabetes. So by doing an examination of the eye, when we look inside the eye and we see changes in the retina, that's going to make us want to refer this patient quicker to their family doctor and make sure that the patient's blood pressure is good, make sure their cholesterol is good, make sure they're not smoking, and just overall manage better the patient's overall health. So again, the eyes are the window to the soul, window to the body. So when you come in for an eye exam, we look at the back of the eye. There's a lot that can be told by looking inside the eye. So we're not only helping the eye health, but we're also helping the patient with their general health also. Now, we look at our younger patients. We always worry about what's happening to our children. This report says that hypertension or high blood pressure may be a rising health concern for kids and teens. And this study came out of the University of Michigan Health System, and this says that high blood pressure may be a rising health concern for children and teens, yet it's often missed. And a reason for the slip-up is that doctors usually don't take children's blood pressure at every visit, and usually only write it down about 1/4 of the time. So, we think kids are healthy, but, there is, and I have some studies that show that there's an increase in obesity in children that we're going to talk about, but it's important that we watch our children, make sure that obesity isn't a problem in kids, and monitor their blood pressure. So these are just some of the newest studies that are out. In our next segment, we're coming to the end of our first segment here. We're going to take a quick commercial break. In our next segment, we're going to look at some more news that's out there as far as eye care and health. Remember, you're watching Eyecare Today. I'm your host, Dr. Thomas Kislin, and we'll be right back. Welcome back, everybody. Again, you're watching Eyecare Today. I'm your host, Dr. Thomas Kislin. And just to remind everybody, if you have any questions, please feel free to contact us at any one of our offices. Our Hazleton location is Hazleton Eye Specialists on the Airport Beltway in Hazleton. Our phone number, 453-2020. Again, that's 453-2020 in Hazleton. And for our Stroudsburg patients, or patients in that area, Stroudsburg Eye Specialists, 852 North 9th Street in Stroudsburg. Our phone number there is 421-3342. Email us any questions. Our email address is www.drkislin.com, so feel free to contact us with any questions. What we're going to follow up with in this segment, everybody, is what's new in the news as far as headlines regarding eye studies and general health. And what I mentioned in our last segment is every day I get email blasts on my iPhone whenever there's a new study that comes out. That's one way that we keep up. I get these email blasts, make sure to read this study and pass any of this information on. So we're just going to go over some more of these interesting studies. Usually we see our diabetic patients, if they're well controlled once every 1 or 2 years, if they're under moderate control, if their blood sugar's hopping around a little bit, we'll see them maybe once a year. This study says that biennial or twice a year retinopathy screening of type 2 diabetes patients may be effective. And this study came out in the United Kingdom. And what it says that screening patients with type 2 diabetes every 2 years for retinopathy rather than annually is an effective strategy that could be implemented in the UK. Again, this is published out of the United Kingdom. So more will have to be seen on whether this is effective or not. If you're like me and you like your cup of coffee every day, you like to go to either Starbucks or Dunkin' Donuts, this study is for you. Now, this doesn't happen to have anything to do with Eyecare, but I just thought it was a really interesting study. Coffee consumption may be linked to reduced mortality risk. So this came out of the New England Journal of Medicine, and I'll quote directly from the study. Compared with men who didn't drink any coffee at all, those who drank just 1 cup per day had a 6% lower risk of death during the course of the study. Those who drank 2 to 3 cups per day had a 10% lower risk, and those who had 4 to 5 cups had a 12% lower risk. So if you like your coffee, make sure to drink your coffee. Also quoted from the study, coffee drinkers also were a little less likely to die from specific causes: heart disease, respiratory problems, strokes, injuries and accidents, diabetes, and infections. So very general study, but I think it's an interesting study. Always remember to consult your family doctor, your health professional, if you have any questions about anything as far as your general health goes. Now, when we talk about our kids, one thing we hear in the news a lot is weight problems, obesity with our children. Here's another study that came out of the Journal of Pediatrics, and it says that half of U.S. overweight teens are at risk for serious health problems. So again, to quote the study, half the nation's overweight teens have unhealthy blood pressure, cholesterol, or blood sugar levels that put them at risk for future heart attacks and other cardiac problems. Nearly 1 in 4, that's 1 in 4 American children may be on the verge of developing type 2 diabetes or could already be diabetic, which is really scary, folks. They could already be diabetic, representing a sharp increase in the disease's prevalence among children ages 12 to 19 since a decade ago, when it was estimated that fewer than 1 in 10 were at risk for or had diabetes. So as we see children maybe being more sedentary, working on the computers more, playing video games, not outside running around, we see this increase in obesity, which can actually lead to possibly an increase in diabetes. So that's really scary. Make sure our kids are getting yearly wellness visits and getting checked. This is a study that came out in May from the Journal of Pediatrics. Pre-diabetes, again, skyrocketing in U.S. teens. So again, we have another study that's telling us about the possible rise in the incidence of diabetes in children. And Dr. Dorothy Becker, who's the chief of endocrinology and diabetes at Children's Hospital of Pittsburgh, said that doctors, parents, school and hospital administrators, and community leaders all need to take overweight and obesity seriously. So we're seeing this, again, rise in obesity and possibly in diabetes in our children. So it's something we really need to be aware of. As technology changes, we can do more and more to help our patients see. And there's a lot in the news and in the literature and with the upcoming presidential election about the use of stem cells. And no matter what side of the aisle you may be on, stem cell research can really impact a patient's life if it turns out to be beneficial. This is a study out of the United Kingdom again, and for the first time ever, 2 patients in Great Britain receive eye stem cell transplant. And let me read what the study says. 2 people have had stem cell transplants into their eyes as part of a clinical trial to restore their sight. The new technique has been developed by Scottish specialists to reverse what's called corneal blindness, and it is believed to be the first treatment of its kind in the United Kingdom. Both patients have what's called corneal blindness. Now, there's certain conditions that affect the front of the eye, which is the cornea, and there's certain conditions which affect the back of the eye, which is the retina. So things such as macular degeneration, diabetes can affect the back of the eye, the retina. We're talking about the front of the eye. So there's a condition called Fuchs dystrophy. There's a condition called bullous keratopathy. There's a condition called keratoconus. And these conditions affect the front of the eye or the cornea. And that's what this study is discussing. Both patients have this corneal blindness, and until now, the only treatment was to actually do a transplant of the cornea. So what would happen is a patient who donates their organs after they pass away, their corneas would be removed and transplanted into the recipient. So now, instead of doing a cornea transplant, this procedure now allows reversal of what condition they have. So this is a stem cell transplant instead of a full cornea transplant. So pretty exciting news out of Great Britain. This study says that vision loss may contribute to problems patients with MS as far as their walking goes and their gait. And vision loss, especially in low light, may contribute to problems with walking in MS patients, according to this research presented at the America's Committee for Treatment and Research in MS joint meeting. So what they found, patients in lower light situations, such as when it's dim outside, maybe a cloudy day, they have more trouble than when it's a bright day. And the recommendation, very simply, was we can make what are called yellow tinted lenses. And these yellow tints in glasses can actually help increase the contrast for patients and allow them to actually walk more easily, especially when they have MS. And again, MS can actually affect how a patient walks. It can affect a lot of conditions, but mostly it's their gait and how they walk. So interesting study for our MS patients. What we're going to do, folks, we're going to take another quick break. In our last segment, we're going to go over some more studies and talk about some more research. Again, you're watching Eyecare Today. I'm your host, Dr. Thomas Kistel, and we'll be right back. Welcome back, everyone. Again, you're watching Eyecare Today. I'm your host, Dr. Thomas Kistel. And just as a reminder, if there's any questions at all, any comments, any questions about what we're talking about today, you can contact us. Our Hazleton location is Hazleton Eye Specialists. The phone number there is 453-2020. Our Stroudsburg location is Stroudsburg Eye Specialists. Our phone number there is 421-3342. And as always, please feel free to email us any questions. Our website is www.drkislen.com. What we're doing in this show, everybody, is we're talking about what's new in the news, new studies that are out, any new studies that tell us about technology, or what we should be doing as far as healthcare as it in regards to the eyes. And the one great thing about technology is every day on my iPhone I get these email blasts about new studies in regards to just general health and the eyes. And I just wanted to share some of this latest research with you. One study, this is a study that comes out of the Journal of Infectious Diseases. Older people at low short-term risk of shingles recurrence. Now, shingles is a condition that can be really nasty, especially in our more senior patients. And shingles is a virus. So it's a form of the herpes zoster virus. And you can get lesions across the face, the scalp, certain parts of the body, but it actually can affect the eyes. You can actually get shingles that gets into the eyes, and it can cause sight-threatening issues. So what this study says is that once a person develops shingles, their body's immune system develops memory of the exposure that helps with the immune response if the virus reactivates. So in the short term, so immediately after you have shingles, it's not important for the patient to run out and immediately get the vaccine. But in the long term, research still shows that it's important for patients to get the shingles vaccine. So again, everybody, if there's any questions about anything we have, always remember to consult your healthcare professionals with any questions regarding that. But shingles can affect the eyes, so when we see a patient that has shingles and it has affected their eyes, I always send them back to their primary health provider and make sure that they talk to them about the shingles vaccine. Very important. Talking about our children again, another study that comes out talking about diabetes and children. This study was funded by the CDC and Prevention and the National Institute for Health. Now this study talks about type 1 diabetes. The last couple of studies we talked about with children talked about type 2 diabetes. Type 2 diabetes we get more from being overweight and obesity. Type 1 diabetes is more of an autoimmune condition. So what this study says is that type 1 diabetes is becoming more common in U.S. children. And this is of grave concern, according to the researchers, because these youth will live with diabetes most of their lives and may develop diabetes-related complications. Why this is happening, they're not really sure, but there's more research that needs to be done on this. But again, this is another reason why it's important for children to make sure they get their yearly wellness visits and stay active and stay healthy. Everyone's always looking to diet and things that may work as far as their health goes. And again, this study doesn't have really much to do about the eye, but I just thought it was an interesting study to throw out there. Low-carb diet may be better than low-fat diet for maintaining weight loss. And this study came out of the Journal of the American Medical Association, and I'll just quote from this study here. Research found that dieters who are trying to maintain their weight loss burn significantly more calories eating a low-carb diet than they did eating a low-fat diet. So again, if there's ever any questions about diet and health, make sure to consult with your healthcare professionals regarding that. But again, I just thought that was an interesting study. Patients who are interested in refractive surgery or surgery to get rid of their glasses, all come to us every day wanting to know about whether this procedure is right for them, if they're going to see well afterwards. One big thing we always worry about with refractive surgery is a condition called dry eyes. Dry eye is a condition that affects almost 60 million Americans, and we know through research that after LASIK, dry eyes can be made worse. Now, LASIK is a procedure where a flap is made in the cornea, or the front part of the eye. Laser is used to resurface that cornea. The flap is replaced, and then the patient actually sees right afterwards. There's a second procedure called PRK, stands for photorefractive keratectomy. PRK uses laser only, and there's no flap made. There's no incision that makes the flap. And for years and years, we always thought that patients had more dry eye after LASIK than they did after PRK. And this study, which came out of the Journal of Ophthalmology, said that risk of dry eye is similar after LASIK or PRK. So both procedures seem to be the same. What that comes down to is if you're thinking at all about refractive surgery or the surgery to get rid of your glasses, it's extremely important that you get a very good preoperative exam. Make sure you're a good candidate. Dry eyes can be a devastating condition, especially after refractive surgery. But the good news is there's treatments for dry eye. So patients who are looking to have refractive surgery and we diagnose them with dry eye, we treat them first and hold off on doing the surgery until we know that their corneas are stable and not dry anymore, and then they can successfully have the surgery. So it's just very important to have that good preoperative exam. Cystic fibrosis is a condition where the lungs don't develop properly in newborns. And as children develop, they have a lot of difficulty breathing, are at risk for infections, and really can have a tough go of it. So there's a new drug out to treat cystic fibrosis, but what we found with this new drug is that it can actually cause the development of cataracts in young children. So I'll read the headline of the study. CF, or cystic fibrosis treatment, may increase risk for juvenile cataract development. So this is a new drug by Vertex Pharmaceuticals, and the name of the drug is Kalydeco, and we found that this may increase children's risk of developing future cataracts, and it's based on a laboratory animal study. So the FDA has actually now asked the company to do further human studies on this to see if this is truly the case. Again, cystic fibrosis treatment and the development of cataracts. Chocolate consumption reduces likelihood of stroke in men. So this research provides echoes of similar findings in the cardiology literature that eating chocolate can promote cardiovascular health by lowering blood pressure and helping to improve the proportion of bad cholesterol in the bloodstream. So again, if you like your chocolate, again, consult your health professional before taking any advice from these studies, but that may be a link that you can have maybe a little bit of chocolate every day. Motor vehicle accidents involving men may decrease after cataract surgery. And this is a study that came out of the Journal of Clinical and Experimental Ophthalmology and found that cataract surgery appears to have led to a 15% decrease in the amount of motor vehicle accidents involving male drivers in the year following surgery. So cataract surgery, folks, again, you've heard me say it's a simple 6-7 minute, no needle, no stitch, no patch surgery, can greatly benefit your vision. So if someone's developing cataracts, there's no reason not to do it. You're going to see better. And now, according to this study, actually going to have less risk of car accidents. Now, our last study we're going to talk about today, folks, only half of Great Britain's wet macular degeneration patients seen within recommended time frame. And this study says that only half of patients with a condition called wet macular degeneration are seen within the recommended time frame of 2 weeks, according to a survey of eye doctors in Great Britain. And this is kind of scary, folks, because as we know, Great Britain has a form of socialized medicine, and our population is only getting older. Macular degeneration affects our more senior patients. So with the immediate incidence of macular degeneration in a patient, they need to be seen immediately. When we see a patient with macular degeneration, I can usually get them in to see our retina specialist, Dr. Patel, within about 3 to 4 days, sometimes even the same day. So it's very important that patients are seen quickly with macular degeneration, so just remember that. So that's a lot of the news that's out there as far as what's new in the literature and all the latest headlines. I hope it's been informative. If there's ever any questions, again, feel free to contact our office, Hazleton 453-2020, Stroudsburg 421-3342. Again, you've been watching Eyecare Today. I'm your host, Dr. Thomas Kislin. We'll see you next time.